It is something that impacts the lives of upwards of 20% of veterans who served in Iraq and Afghanistan. PTSD occurs when an individual experiences or witnesses violence.
PTSD is difficult to treat because individuals have problems processing what they experienced. An answer to treating PTSD may come from a surprising source, and Dave Delozier joins us with more on that. Dave?
Yeah, absolutely. You know, some small trials have shown that a drug called MDMA combined with psychotherapy is very effective in treating PTSD. The results are so encouraging that the FDA has labeled it a breakthrough therapy. Perhaps the biggest challenge MDMA faces is the name it's known by on the street, ecstasy.
PTSD is a very hard condition to treat.
And for many veterans, the horrors of combat remain locked away in their memory when they come home. They are unable to talk about and process what they experienced. PTSD is more than nightmares. It claims lives and destroys families. But about 15 years ago, an organization called the Multidisciplinary Association of Psychedelic Studies, or MAPS, began a study. Using MDMA, a drug known on the street as ecstasy, during psychotherapy, it allows veterans to process the trauma.
MDMA opens up a space where people feel safe, they feel better about themselves, they feel better about other people. It's an expanded mind space that gives them the room to often look at the trauma again in ways that allow what we would call reprocessing. I suppose you could call it healing, really.
Dr. Charles Raison is on the scientific advisory board for MAPS. To be clear, the ecstasy sold on the street often contains other drugs that can cause problems. Trials using MDMA, along with psychotherapy, to this point, on 107 patients have shown great promise.
There's a massive reduction in symptoms. And the striking thing is now we've followed the data out for a couple of years, and if anything, over time, people get better and better. The rates of remission are north of 60%.
A large phase 3 trial is set to soon begin, but perhaps the biggest hurdle MDMA faces is the stigma associated with it.
It's such a pressing problem that if something like MDMA can really have these sorts of effects, you know, it's kind of time to let the stigma go. We're not talking about raves, we're not talking about parties, we're not talking about giving it to people to take it home. We're talking about using it in a very controlled setting on an extremely time-limited basis for this very specific purpose of treating these horrible symptoms.
And that is a very important fact to keep in mind. The MDMA is only used during the psychotherapy session. Now, the phase 3 trial is set to begin next year. And Eric and Susan, if this gains FDA approval, it could be used to treat PTSD patients as early as 2021.
Very interesting study.
Fascinating.
There's a lot of promise.
Yeah.
Thanks, Dave.
Thanks, Dave.